All right, so this is going to be hopefully a fairly quick orientation to simulation for Ms. Knobler's clinical or skills group. So we probably will start doing more simulation throughout the semester. I know you guys haven't had much. This is fall of 2017 up to this point, but next semester and then in the following semesters we will have a lot more simulation. So I just want to do a quick run through because I know you haven't seen it. And this is specific to me. The other students can watch it for the other clinical instructors, but just know that it may not be exactly the same, but some of the highlights would be the same. I'm in the older simulation room. I prefer this simulator for my first semester students because the points for vital signs and palpation assessment are very obvious. On the newer simulator, they're not as obvious. They're in the same anatomical location, but his skin is flush all around the simulator. So it's not obvious where you would palpate a pulse or his blood pressure, okay? And I'm going to show you on this in a second. First thing you do when you come to simulation is you're going to talk with your partner or by yourself. Sometimes I do just one student at a time for these simulations. And that can vary per instructor too. I know the other instructors want to get through these quickly, so they may pair people up or do 3 students to a simulation. I don't really like to do that because I want to be able to see each student and see what they're doing, because sometimes following you at clinical I really don't get to see some of those skills as closely as I'd like to. So you're going to get a chart. This chart I grabbed today is Ruth Livingston. You can see it's got her picture here, some general data about her date of birth, prior medical history, recent medical history, and then report. So you're always going to note your report time. So this is at 11 p.m. So you as the student, no matter what time of day, if it's 7 a.m. in the morning, we're pretending like it's 11 p.m. and you're getting report from another nurse, okay? Not going to read that to you because it doesn't apply to the simulation you're doing. Again, more information about her, and these are visible signs that you're seeing when you walk in the room. So alert and oriented, and she is expressing pain. So what's going on with Miss Livingston? Emergency department 4 hours ago. Okay, she had a right femoral neck fracture, so that hip fracture, that's why she's coming to you. I would assume she's probably pre-operative. She's admitted. So these are the orders, and they're all different. Sometimes the clinical simulations, the faculty write. I know first semester Ms. Shoup writes our simulation for first semester, and then your clinical faculty writes the simulation for second semester. So my second semester students, I will have written the simulation, but these all the same. You get orders, handwritten orders, and then here it is. It's typed up like a Cardex or a MAR or whatever. The orders are out there like that. Intake and output every 4 hours. Any medications, IV fluids, LR at 70. So everything's here, but it should be the same as what the handwritten orders were, okay? Name, date of birth, all of that same information is on here. You're treating this like a real patient situation. Here's your documentation on the MAR. So if you give a med, if you give this morphine for the pain, it was last given at 2115, and we're at, what, 2300 now. So it says IV push PRN pain. It doesn't give you a time variation, so I guess you could give it. So if you give any meds, this is where you would document your medications, okay? Any labs if you need them, if there are x-rays or anything, sometimes you'll have a print up of that, or it will come out on your patient monitor. I'll show you in just a minute. So that's what you get. You're going to have, I believe, 10 minutes to research is what I give my students. Again, that's a variation between faculty. The other paperwork that's going to come with this simulation is the checklist. So this is what we're used, I can't really tell what you're seeing here, to grade you, okay? And these vary per simulation because we're looking at different things, right? So here with Miss Livingston, wash hand, check. Introduce self, check. Identify patient with name and date of birth, check. Obtain vital signs, check. Pain assessment using pain scale, mental status, IV site and IV fluid, ask about shortness of breath, auscultate heart, you know, general things. Again, treat it as a real, you're not going to see this. This is how we grade you. This is the grading rubric. for this specific simulation. So we all have this. So you're all graded the same. Check you did it or check you did not, okay? And if there's 20 items on this list, then it's 5 points for each thing that you get accomplished, okay? Here's case considerations that we would talk about afterwards in the debriefing. So you're going to do your chart review, you're going to come in and take care of your patient, go through the scenario as far as you can get through it, and then we're going to do a debriefing, okay? And that's where I talk to you and I give you comments about things that I've seen, or you know, just discuss about your care, stuff that I saw. And these are just suggestions that were written. NLN puts these out, National League of Nursing, and so they're good to use, nursing diagnoses, all that stuff. Okay, so that's the basics of the paperwork. This room is pretty much set up just like the other simulation room. One thing, you're not going to see me, hopefully. So hopefully you're not going to get sick because it may be a little shaky because I am holding this. One thing that is different in here, I usually like to pull in the one-way mirror and I set it over there in front of myself, because you should not be talking to me as the instructor. If you ask the instructor a question, I am not going to answer you. I'm going to ignore you, and I'm not going to make eye contact. You should not be talking to me. This should be your patient. You should be talking to your peer if they are in here with you, communicating with them and communicating with the patient. If something goes wrong in the simulation, you can't find something, then you again need to ask your peer, not your instructor. The instructor is not here. Some instructors I know do talk to you during skills checkoff and simulation, but I do not, okay? So, did your chart review, you've got a plan of care, now let's come in. So you knock on the door. Hello, I'm Brandy, I'm here to take care of you this morning. I've just gotten a report from the other nurse and I've reviewed your chart. But right now I'm going to go wash my hands really quickly and I'll be back to introduce myself further. So, same thing. Wash hands. Yes, check mark off that list. I've got some points. I introduced myself. I'm Brandy, the nurse. Now I'm going to come over and identify my patient really quickly. I did review your chart, but just for safety measures, can you please tell me your name and date of birth? And then I'm going to look at my armband. Yes, that looks correct. And over here we've got another armband and an allergy. Do you have any allergies? No. Okay. As I'm doing that, I'll come around here and try to get things done. Now, if you have two people in the room, one person can do the talking and introduction while the other person says, you know, hi, I am, I don't know, the other nurse, Clara, whatever. And I'm going to be getting your vital signs while your nurse Brandy is talking to you and doing some of the assessment. So, really quickly, let's look at the computer that just shut off. All right, so this is the patient monitor. So up here, if your instructor is really sweet, they will display all of the vital signs and everything you need to know on this patient monitor for you to see. Ms. Knobler does not do that. Ms. Knobler thinks that you all should be able to take manual vital signs. So down here is the instructor's computer. You will not see this. And I can change anything with this patient per the instructor computer. So here's the blood pressure, and I can change the blood pressure to whatever I want it to be. Let's see, 146 over 84, and that's okay. So I can change that. Right now, if I go to take this person's blood pressure, I should be able to hear that. And it's not your typical whooshing sound. It sounds more like a clock, okay? You're not going to be able to hear it on here, but I will show you where you need to place the stethoscope to hear that blood pressure, okay? Same thing with pulse. I can change the pulse. I can change the rhythm on the EKG. Let's see, AFib. I mean, here's a whole list of different rhythms specifically for this simulation that I can change. I can change SpO2, all of that. Same thing here, vocal sounds. I can make him talk. Now this older simulator, his voice box is broken, so we will not be able to talk through him. If I click on these, you won't be able to. I don't feel well. Oh, he got fixed. I just lied. Okay, so this patient may talk during your simulation, okay? Or your instructor may have on the headset and they may be talking through the mannequin, okay? So they will talk, they will answer your questions as a patient, they will not answer your questions as the instructor, okay? So those are a few things there. Breath sounds. We can change his breath sounds to anything we want. Crackles, gurgling, pleural rub. The older mannequin, sometimes students say that it sounds like the plastic is rubbing together. You shouldn't really hear plastic rubbing together. If something sounds like it's rubbing, describe it as crackles or ronchi or something, okay? Give it a name. Same with heart sounds. We can have stenosis, a murmur, a rub, whatever. As my students are listening, I will turn up the volume for the lungs. They go to the heart. I'll turn up the volume for the heart. I'll turn up the volume for the bowel sounds, okay? And same thing with bowel sounds. We can change it to whatever we want. So just be on alert, okay? It's not going to be 100% perfect patient. You will have some things going on. That noise you keep hearing, again, only with the older simulator, is the generator, okay? Try not to take the blood pressure when that's going off, because sometimes it can be hard to hear. So here's the patient. The newer mannequin, he will open his eyes and blink and do all those wonderful things. This one doesn't. It's basically one step up from the mannequins you are playing with in the lab to do your technical skills. So here we have pulse ox, okay? When I put this pulse ox on him, it should show up over here what his pulse ox is. So he's at 97%, and if you see his pulse also came up, he's 156, 157, and that's because I put him in AFib, okay? Your instructor, like I said, will click on things if they want you to see. So here I just clicked on his ECG and it popped up for you to see. Same thing with respirations and blood pressure. Okay, so this blood pressure will pop up in a minute if I wanted you to see it. But like I told you, I do not like to use the monitor with my students. I want them to get manual vital signs. The only thing they should be able to read is that pulse ox, okay? When they put it on. Got to put it on. Now, very obvious pads. He's got pulse sites. Don't press it down hard, just very faintly, and I can feel that, okay? All of his pulse sites, you should be able to feel, okay? This right here is my speaker for my blood pressure. So this is the reason I like to use this mannequin for first semester, okay? Very obvious where you should place the bell of your stethoscope to get your blood pressure. Here's the blood pressure cuff. It's got this extra air tube so that whatever I've programmed into my mannequin through my computer is what you're going to see on your dial here, okay? Now, they didn't give me a stethoscope in here. You will have one on you or in the room. So I place my stethoscope and take a manual blood pressure, just like you did week 2 or throughout your clinical, okay? Okay? Blood pressure, simple, simple. Some other things that you want to look at when you're doing your simulation, I would say always listen to heart, okay? You don't have to do a full 60 seconds, just get a general idea. He is in AFib right now because I put him in AFib, so it's going to be irregular and you should be able to hear that, okay? Listen to lungs, front and back. If you verbalize, I want to listen to your back for your lung sounds, then me as the instructor, I usually tell you, okay, you've got credit for doing posterior lung sounds. And also listening to bowel sounds. Here again are his pulse sites here. If we have a wound or he had surgery, you should have a dressing, drains. I believe my simulation for second semester, he's on a heart monitor. So I'll usually hang the heart monitor on him. That's nothing that you need to remove, okay? So you should never leave him exposed like this. I'm just doing it so you can see the mannequin. Any supplies that you need, if you have to start an IV in that second semester simulation, insert a Foley in that first semester simulation, your supplies should be over here. Anything that you need, any skills that you're going to be performing during the simulation will be on this cart. We put extra stuff out there because sometimes you guys get creative and just decide you need to do something, and it's a good topic for discussion. I've had students insert Foley when they didn't even have an order for a Foley. So just make sure you have an order for it, or you can always call the doctor and request things. Okay, medication cart, you guys should be familiar with this. I was just told by Miss Dewberry we're not using the Metadose, the electronic cart, this semester, fall 2017, but in the future you may see the Metadose for simulation. So basic, basic, basic. Whoever our patient is, Charles Jones, I believe, is one of our simulations. And there's his cart with all his medications in it. Okay. So that's really it. I hope this guy was helpful for you guys. And yeah, see y'all next week for simulation.